Well, in the UK, the British Prime Minister Boris Johnson is self-isolating. This after his Health Secretary Sajid Javid contracted COVID-19. Now, the announcement came from 10 Downing Street. It is an abrupt U-turn from what it was saying earlier in the day. Let's bring in Dominic Velitis. He's in Bristol, England right now with more details on this. So, Dominic, good to see you. So tell us a bit more about this reversal from Downing Street.
Yeah, it is a major reversal, Michael. The Prime Minister, Boris Johnson, and the Chancellor, Rishi Sunak, will now self-isolate after coming into contact with the Health Secretary Sajid Javid at Downing Street on Friday. We were told this morning by an official that they wouldn't actually be doing that. Instead, they would be taking part in a pilot scheme involving daily testing. So, yes, it is a major U-turn. Opposition politicians had criticised the plan this morning to allow them to avoid self-isolation, which is something, of course, tens of thousands of people here are expected to do when they are identified as having come into contact with someone who has COVID. Now, in the last hour, Michael, the Prime Minister, Boris Johnson, has released a statement on Twitter. Take a listen to part of it. Here he is.
I've been in contact with somebody who has COVID, in this case, of course, the Health Secretary Sajid Javid. And we did look briefly at the idea of us taking part in the pilot scheme, which allows people to test daily. But I think it's far more important that everybody sticks to the same rules. And that's why I'm going to be self-isolating until the 26th of July, Monday, the 26th of July.
So a major U-turn there, Michael, and perhaps one of the fastest government U-turns I think I've seen this year. And it's difficult as well to escape the fact that we now have 3 senior government ministers who will be self-isolating tomorrow when almost all legal COVID restrictions will be lifted in England. Michael.
And of course, this happens just before, what is it, Freedom Day in the UK come tomorrow. So what's the reaction there to this, given the reopenings?
Yeah, there's been a bit of a mixed reaction to so-called Freedom Day. Some point to the success of the vaccine programme here and how it's weakened the link between infections, hospitalisations and deaths. Others say there are compelling economic and health arguments, especially mental health arguments, for fully reopening tomorrow. And then there are others as well, Michael, say, look, if it doesn't happen tomorrow when the weather is on our side and the schools are about to break up for summer, then when exactly is it going to happen? That said, case numbers are rising. More than 54,000 were reported yesterday alone. That's the highest number since mid-January. And campaigners here, Michael, are particularly worried about the risk that fully reopening poses to the estimated 3.8 million people in this country who are clinically vulnerable. There is no shortage of experts out there, Michael, who have expressed concern about so-called Freedom Day. Most recently, 1,200 international scientists signed a letter to the Lancet Medical Journal saying it even poses a potential threat to the entire world, that so-called Freedom Day could provide fertile ground for the emergence of new vaccine-resistant variants. And even others have expressed concerns that Britain's position as a major transport hub in the world could see any new variant being spread rapidly around the globe. Generally speaking, Michael, I think there is in fact a little bit more anxiety here about tomorrow than anything else. Michael.
Okay, Dominic, thank you for that. Our Dominic Velitis in Bristol, England.